Welcome everyone to this episode of Claims Corner. I want to remind you that if you have any questions for our speaker today, please feel free to put them in the chat box or the Q&A box, and we will answer them at the end of the session. But for now, I'm going to turn it over to our guest speaker, Dr. Sharon Croisant.
Thank you, Julie. I'm really happy to be here today. If you give me just a moment, I want to share my screen. Okay, can you see my slides okay?
Yes.
Great. Okay, so maybe by way of introduction, I'll just explain a little bit about my background. I'm a professor in our brand new School of Public and Population Health here at the University of Texas Medical Branch in Galveston. And being on the coast, and if you all are familiar with Hurricane Ike, then you know that we've experienced our fair share of disasters, and it's been necessary to respond to catastrophic events. I also wear a number of other hats here at the university. I'm the Director of Community Engagement for our Institute for Translational Sciences, and also for our Gulf Coast Center for Precision Environmental Health and our Baylor Rice Superfund Research Program. These last two are pertinent to this conversation because we've been funded continuously by the National Institute of Environmental Health Sciences since 1997. And when we've had a number of storms, we were asked to respond to represent them. That began as early as 2005 with Hurricane Katrina, followed 3 weeks later by Hurricane Rita. So we got a little bit of trial by fire and what it meant to be somewhat secondary responders to these catastrophic events, and to take the field to help as much as we could with initiation of recovery. So I'm going to talk today about that response to catastrophic events. And I've called this tongue in cheek, not all heroes wear capes, but sometimes they do. Let's see if I can switch. There you go. So this is actually my second time to be able to talk to y'all. And the first time, we also talked about hurricane preparedness, but mostly in the context of floods. And what I discussed was really planning and preparing for from a more physical risk perspective, and understanding and preventing those risks, how to help your clients and colleagues to also prepare for response and recovery. And really in a context of temporality, that, what do you do immediately? What can you do while that's going on? And then what do you do afterward? But the thing that rose to the top that it seemed like most people wanted to talk about was stress management during the event itself. So today I'm going to talk more about that. And I think we can agree that many disaster responders make heroic and, if not Herculean sometimes, efforts to help people in need. But when you're under a lot of stress for an extended period of time, it really can be dangerous to both your physical and mental health. So today we're gonna explore some experiences that some of your colleagues voice, and I'm calling this cautionary tales from the field. But really, it's not a question of intending to alarm anyone, but there's a lot of good advice here. And then understanding and preventing risk to mental and physical health. What can you do to prepare before anything happens? And then planning for that, both from a perspective of an individual and then also as a member of an organization. Then we'll talk about during and after whatever the event might be, how you could identify and anticipate what risk might be, and how you can better prepare to deal with it, and mostly through coping mechanisms, stress management, and then making sure that you have plenty of support services and resources to do so. But before we get started with that main discussion, I really wanted to provide a couple of different contexts for what is a disaster. Well, these are some that that have been out there for a very long time. Disaster, and according to the Oxford Dictionary, is that an event, whether it's natural or man-made, that causes great damage or loss of life. A modified definition that comes all the way back from '94 is an event that is a natural or can be man-made disaster that causes increased mortality, illness, or injury, or disrupts and destroys livelihoods. but this is an exceptional event. Well, actually, according to the American Red Cross and the International Red Cross, as well as the National Academies of Science, um, there's a definition that I think is really more accurate, which says that it's anything that causes a serious disruption to either a community or an individual or family's ability to cope using its own resources. So, and I think that's a better one because you can have a very small town that experiences a major disruption or a disaster, either a tornado or a hurricane or a fire that can rapidly exceed the community's ability to cope and to recover. Whereas a larger town or one with many resources, it might not be such a terrible event and they might be able to recover much more quickly. I think what people miss sometimes is that you as an individual are also differentially impacted in your ability to cope depending upon what resources you have to draw from. So I wanted to ask, in my title slide, I talked about what's a hero. What makes a hero? Do they wear capes, or not wear capes? Well, I think one way we might assess what a hero is someone who displays uncommon courage in the line of duty, or or does extraordinary things when under duress. And one of the first that came to mind for me was, Captain Sully Sullenberger, when he was able to land his aircraft, in the middle of the river and save all these human lives. So I think we've all thought about, or recognized that there are these, men and women who have helped respond, recover, and rebuild following some of our nation's most compelling disasters, including something like this. We don't always think about the heroes who really do go above and beyond, their scope to help those in need. And here I want to point out that the first responders in this case were the ferry captains. They were already on the water. They rapidly mobilized and organized a response. As you can see here, one of the things that you didn't see in that first photo of people standing on the wing was that river is icy and ice rapidly began to form on the wings and the people couldn't maintain their footing. So they slipped off into the water, and that's what these ferry boats are doing, is rescuing people as they come off. They had to be very careful because they were really worried about jarring the plane in any way and knocking even more people into the water or creating any kind of wake where they might actually be the hazard. So again, I would consider these men and women heroes as well. And here's where the capes come in for me. For me, capes is when responding to a disaster or an event. You do so with courage and compassion, a willingness to take action, to be prepared to do that, to take the field with experience and efficacy, and then also keeping in mind all the time the importance of safety for yourselves and others. And in this context, when we think about the pandemic and a lot of things that have happened over the past couple of years, some heroes drive trucks. Some of them are, responsible for restoring power. I think about some of our frontline healthcare workers here at the university who have dealt with the pandemic day after day after day. And to me, they're very much heroes. But one thing that they have in common is that they all do display adherence to capes in doing their job. So before we get into the meat of our discussion today, I wanted to think about, our definition of disaster. Because usually we think of a disaster that swoops, something comes in and happens, and then it's over, and then we get to deal with the varying stages of recovery and of the immediate response and recovery, I should say. But I think there's been events in the last couple of years that have made us rethink that, from an acute versus a chronic perspective, because certainly with COVID-19, but also with the persistent wildfires that we've had, here on the Texas, and the Gulf Coast, we've had a series of unprecedented storm seasons and floods. We experienced, Winter Storm Uri, and then throughout all of these, we've had these extended power outages. So for us, this notion of disaster has become sort of rather than just this acute event, it's this long disaster that's persisted over time. And when that happens, it's really easy for exhaustion and despair to become a threat, both to the people who are experiencing it as victims, and then those who serve them. So when I thought about doing this talk today and about the work that you all do, the work that I do is different. We work with first responders. We work with communities that have directly experienced events, and work with them to try and expedite recovery and to facilitate that over time. And so my experience with insurance and adjusters and the staff who support them was different. So I began looking at what some experiences of your colleagues have been in the field. I thought maybe that would be a great jumping off point from us. Your experiences may be different from theirs, but I think it's important to recognize that these are things that have happened. So these are all quotes from a website, where a forum where insurance adjusters were exchanging their perspectives on response to disasters. One pointed out that there's this risk of burnout, that when you're in the field and there's a heavy workload, you can't get a lot of exercise. You have limited times to relax. You often have a lack of sleep, and that all of these things contribute to burnout. But that one coping and a negative coping mechanism is that over time you become numb. And that after you hear story after story of people who have gone through this and experienced such grief and in many cases sadness, that the adjuster may actually start to lose empathy, and that can make them more or less good at their jobs. And several also experience that inexperience can be a risk factor, or more importantly, that experience can be a protective factor. And that it's particularly over time, that understanding and accepting what you can do can result in less mental stress and increase your ability to be able to perform. But that newer adjusters who are not familiar with this type of situation, they may just keep going on, and they don't necessarily realize the toll it's taking on them, or they may not even want to admit what stress they're under, because they don't want to appear that they're unable to perform their responsibilities. There's emotional overload. We heard actually in our discussion this last time that when you're taking call after call and listening to very similar stories, sometimes of devastating, circumstances in people's lives, that the adjuster is, the face of the insurance company, and yet that also means that you get, a lot of the frustration that's expressed, or the sadness, or the anger, or all of those things that people are going through. And so that's not only listening to the emotions expressed by the victims, but also it can result in an emotional overload for those who are having to experience this vicariously. There can be isolation out in the field. So if you are not with a group of your peers and are out there on your own, you can begin to feel very isolated, and problems can feel magnified, especially if you have little experience and you don't know where to go for help. So really along those lines, one person voiced the importance of social support in responding to Hurricane Andrew, saying that he was one of many adjusters, and an advantage of that was to break that tension and to work through some of what they were feeling. They would meet every day after work and hash out what happened and provide advice and just a friendly ear for their colleagues. Another cited that, and we've heard this, from others, is that inability to relax, that it was very difficult to see adjusters going into shell shock because there was just so much devastation around them. And it was very difficult to focus on the job at hand. And part of the response to that is inability to sleep. And this person said, that, he would find himself waking up in the wee hours of the morning and go down the hall and be able to hear that other people were still working, or that they were also unable to sleep or rest. And that can result in this chronic exhaustion. And the temptation, I think, when there's great need that's persistent, is to drive yourself to really beyond, above and beyond what is healthy to do so. And this person said, we were taking no time off and working these 18-hour days. but that can render you unable to do your job at all when it catches up with you. So part of the issue is that there seems to be a stigma with seeking help for perceived mental health issues. One person mentioned that that their perception was that many adjusters will suffer some type of PTSD, post-traumatic stress disorder, that does get better over time after getting back to a home environment where you can relax and sleep and get caught up on exercise and healthy things. But a lot of people are either afraid or reluctant to seek assistance. And this next person gave a reasoning for that when you're in the field and the only way to to admit that you're having problems is to say so in front of everybody, or when it's a glassed in office and that you have to say, oh yeah, I need to see the counselor in room 6, then people may be reluctant to do that. So all of these experiences that we've heard, about isolation, emotional overload, exhaustion, sleep deprivation, stigma associated with admitting that you need help and seeking that help. Well, what kinds of problems could you end up with? Well, these are the definitions of post-traumatic stress disorder. And I think we see a lot of this in the stories that were recounted, that it may be an increase or decrease in activity level. People may turn to alcohol or substance use to cope. They may have difficulty concentrating or listening, or may become irritable, have outbursts of anger, may have difficulty getting along with others. They might be unable to relax or to sleep, and that can result in a decline in job performance, some absenteeism. There might be emotional outbursts or inability to control your emotions, maybe excessive worry, or even avoiding places or things that can trigger memories, and then becoming clumsy or accident prone. Physical reactions can include GI problems or headaches or other aches and pains, visual disturbance, weight loss or gain, sweating or chills, tremors, being easily startled, having chronic fatigue or sleep disturbances, and immune system disorders. And then there's those psychological or emotional problems. One person that actually wrote in on on that forum said that one of the warning signs for him was when he felt in the zone, which was feeling euphoric and like he could handle anything, because usually that happened right before he really became very low and felt like he had very low energy. It can you can be in denial of what you're going through, have anxiety or fear, depression, maybe guilt over it's like a survivor's guilt, or even the opposite of that, apathy about what's going on, or even grief. You can experience some cognitive problems, difficulty remembering, disorientation or confusion, feeling slow or inability to concentrate, having difficulty setting priorities or make decisions, or having a loss of objectivity about decisions that need to be made. Socially, it can be people that feel isolated or seek isolation. They may blame themselves or others for what some of the experiences that they've seen or been through. They may have difficulty in giving or accepting help, or have an inability to experience pleasure or have fun. So you've got all these things going on, and in different combinations. Not everyone feels every one of these symptoms, but this is really a compounding of the danger that you are in out in the field, because coping with a disaster can cause many of these same feelings, and PTSD, if you have it, can compound that, those feelings of loneliness, isolation, depression, anxiety, etc. So here's where we get into I think the better part of our conversation today, which is what can you do to prepare for this? Well, I think the first thing is to really understand what your risks are, and recognizing that depending upon what the nature of the disaster is, those risks may be different. So experiencing a flood or responding to a flood may be quite different from responding to a fire, And this picture is from my hometown, in which case, we had floods and fire going on at the same time. So one of the things I wanted to point out is that there is, and I've got a reference list here at the end of this discussion, where you can get hazard information sheets that are really valuable for you and for your clients. They have them for 19 different types of disasters. This is on ready.gov. And it's not just information, but it tells you how to build toolkits to respond to different types of emergencies, bug out kits for people who might have to flee a fire or a flood or a storm, etc. So I think this is a really, in terms of physical risks, I think that this is really a good place to go if you haven't been there already. And I wanted to focus just for a moment on compassion satisfaction and compassion fatigue, because I think that this is an important part of what enables you to do your job and perhaps why you even chose your job. So this notion that there is satisfaction or fatigue gained from doing your job, and that's related to your compassion. So what do we even mean by that, and why is it important? Well, compassion and satisfaction are the positive aspects of working as a helper in response, whereas fatigue is the cumulative negative effects of working as a helper. The fatigue can result in burnout and inefficacy or feeling overwhelmed, and or you could experience work-related traumatic stress, and that might be primary or secondary. So it might be something that you experience directly while you're out in the field, or it might be just as we talked about, when you have these secondary exposures because you're listening to other people's events repeatedly. So, in a simplistic way, we can think of this as, the good stuff versus the bad stuff. And this is really what is emphasizing is that, that this really needs to be balanced. You're going to have some degree of compassion fatigue. If you weren't, otherwise, I think probably you're not doing your job. But there's a need to balance these two. So in what I wanted to point out with satisfaction and fatigue is that they're kind of this different aspects of the same things. So if you get pleasure and satisfaction from doing your job and by helping people, being a part of them, that satisfaction can be driven by the work that you're actually doing and the help that you are providing. The system, if it works well and is supportive of you, working with your colleagues, if, for instance, the gentleman who talked about being in the hotel and being able to share his burden with others, as long as your colleagues are supportive, that's a great thing. And then your beliefs about yourself and as seeing yourself as a helper, maybe even that hero, but being able to be effective in helping others. And then altruism, the sense that what you're doing is good and benefits others. But the flip side of that coin is that providing care when, sometimes all the care that you can provide is not enough to deal with people's loss. And that's difficult. The system, if it doesn't work well, and it's difficult when I think for many people, delays and waiting is really hard, but we all know that waiting is a part of the system, that processes sometimes grind slowly, and particularly when you're dealing with widespread disasters. With Hurricane Ike, that was across the entire Gulf, and so the wheels of the bureaucracies, the various bureaucracies, turn very slowly. Working with colleagues, if all of your colleagues are under a lot of stress and not capable of providing support for one another, then that could actually become negative. And then sometimes your beliefs about yourself, if things are not going well, turn negative, and you begin to feel those senses of isolation and inability to be effective. And that's when you're at risk of this, a burnout, especially if you're directly exposed to trauma. So all I really want you to see from this, it's a different, it's a different view of what we've looked at, but divided into your environments. So your work environment can be supportive. It can also be a source of fatigue. Your personal environment can also be, a source of satisfaction or fatigue. But about those two, what's important is that there are things that you can do to directly affect or change or, or be, or help the situations in those environments. Really, the only one that you can't impact directly is what happens to you in the field. And you can do as much to prepare for that and to set up supportive systems, but those are mostly going to be within your work or personal environment. So what can you do? And so there are things that you can do to prepare at both the individual and the company levels to reduce the likelihood that you're going to experience fatigue or burnout. Certainly, there are many things that you can do to prepare beforehand to both prevent and anticipate those physical and sometimes and mental health adverse effects. And what we strive for is really resilience, or the ability to successfully adapt to whatever stressors you experience, and to be able to maintain physical and psychological well-being in the face of adversity. These are some of the protective factors that you can engage in. So you can seek, and when I say specialized training, that might be individual, that might be based upon what you as a person need. It might be for to deal with stress management. It might be coping mechanisms. It might be physical training to prepare for being in the field. So it might be to acquire professional skills that you don't have. So for instance, for very junior adjusters or investigators, it might help to do an internship with someone who's very experienced in the field, or to take some courses. All of that will lead to confidence in both the, your individual and your team capabilities, help you develop these coping skills, satisfaction with life, and then practicing gratitude can help. These are all skills that can be learned and practiced, and they're actionable at both the individual and organization levels. So other things organizations can do is to plan for disaster mobilization, to have clear written protocols and strategic plans about taking the field. It's been proven that feeling well prepared and knowing that you are going to be able to get out and do your job well, those are actually protective factors for people taking the field. Be sure to include all team members in developing protocols and ensure that they're adequately trained to deal with multiple aspects of their jobs. Because again, teamwork and this sense of community are also protective factors. And then gather as much information as possible about the disaster to reduce dangers from disaster exposures. Again, back to that ready.gov, maybe helping your clients to best prepare will reduce what you have to deal with in the field. So, and then these perceived dangers are threats to your sense of well-being and safety. That can result in anxiety, depression, and general mental health issues. So anticipating them can be helpful. It gives you more of a feeling of control before you even get out in the field. It's important to have clearly defined leadership and sub-teams, and determining things that could happen or that could prevent some team members from participating. And because it's known that organizations who put the welfare of their team at the forefront, that they're more successful. One of the things that, now this is advice that, that came, from professionals, but they say to model the structure of the team on the incident command system. And my question for you is to whether or not that actually is good advice, because I think it would work for other first responders, perhaps. And it's important, of course, to recognize what the incident command system is. But I think that this is something that would need to be discussed. And then really to ask potential responders before the disasters to be aware of the stress that they're dealing with, and to be prepared to assess whether they have the capacity to deal with additional stress that will be involved in the response. It's really important to know what work people are doing during the disaster, to recognize that. It empowers staff, and it acts as a protective effect when it helps them feel less alone, and to know that they're being supported and that their contributions are being recognized. So risks that people can be exposed to during the event, obviously physical exposures to hazards. It's known that the closer you are to the epicenter of the event, the more likely you are to experience negative effects. That includes fatigue and impacts on mental health. Emotional involvement with victims can become a risk. It's important to be able to maintain that professional distance to a degree while still being compassionate. And then some of the job-induced stressors are not having access to information or resources, or having unfamiliar or conflicting duties, too heavy a workload, excess exposure to morbidity or mortality, either directly or indirectly through contact with survivors, and then poor leadership. So coping while things are going on. It's important to adhere to established safety policies and procedures. And in order to do that, you have to have those protocols in place. It's important to encourage and support coworkers, and to recognize that not having enough to do or waiting are just parts of the disaster mental health response, and the response itself. That sometimes we always say, I'm sitting around twiddling my thumbs, hurry up and wait, and but that's all part of it, and we need to recognize that and be prepared to deal with it. It is important that we school ourselves to take regular breaks, particularly if we have a troubling incident, and and after each work shift, that to practice relaxation techniques, to get nutritious meals and enough sleep and exercise. I think a lot of people self-medicate, but it's helpful to avoid caffeine or alcohol or drugs or even tobacco, because that can sometimes compound problems. It's really important to stay in contact with family and friends, and to pace yourself. It's important to be self-aware, to recognize early warning signals of stress and negative reactions, but also to accept that you may not be able to see it in yourselves, and to rely on your colleagues to help you with that, and to provide that support for your colleagues as well. To recognize that over-identifying with or feeling overwhelmed by your clients' experiences may signal a need for support and consultation, and that's a natural response. It's about being human. And many of us are empathetic, and it's difficult to not feel that. To understand the differences between professional helping relationships and friendships, to help maintain your appropriate roles and boundaries, and to examine, if you have them, personal prejudices and any cultural stereotypes that you might have that would preclude your ability to respond appropriately, to recognize when your own experience with trauma or your own personal history might interfere with your effectiveness. An example that I have of that is when Hurricane Ike came through, I lost everything. My house was, sustained a lot of flooding, and yet because I was on site, I was called upon to be a resource for others. And in retrospect, although I was able to do what I was asked to do, I probably wasn't the best person, since I was going through my own trauma at that time. I probably wasn't the best resource for others. So, and it's good then to know that, I could draw on someone as a backup who could help me and to help others, and, when I couldn't. So I think it's really important to recognize that, you have personal vulnerabilities, and that it's not unnormal to have emotional reactions. And because of that, it's important to have both team and supervisor support. Stress management. Familiarize yourself with signs of stress and how you in particular respond to stress. Get as much exercise as you can, get enough rest as you can, try to maintain a healthy diet, try to have a life outside of your job, even if you are in the field. Draw strength from your faith, your friends, your family, whatever that might be. Try to maintain a sense of humor, have your own personal preparedness plan, participate in whatever training is offered at your workplace, and seek out other training if it's not offered. Be sure and get regular physical checkups, and ask for help when you need it. physical tension, there are things that you can learn to help relax. Do some breathing exercises, do yoga, meditation, stretching exercises, progressive relaxation techniques. You can get the tapes, or apps that will help you relax, and some that can help you prepare for sleep. Be sure to pace yourself, take time for yourself, because that's necessary. So recharge and use your free time to decompress. And then make sure that you have time and space and the opportunity to talk about your emotions and your reactions, either with coworkers or others during appropriate times. And these are tips that came from your colleagues in the forum. Manage your workload. Be sure and set your task priorities and realistic work plans. One gentleman pointed out that, that it's important to have, for him, it was important to have a map, and because it was very stressful to him if he got behind in his schedule, so that he would map out his visits to clients to make sure that he had plenty of time to get there, and that he wasn't going to be disappointing anyone or disrupting anyone else's schedule. Again, remember that waiting is part of the disaster response. This is somewhat repetitious, but I think it's actually more realistic than some of the advice offered by the experts, because eating right may be eating as well as you can, or sometimes when you can, because in a disaster situation, there may not, it's not like, there's restaurants or grocery stores open sometime. So be as prepared as you can to eat as healthily as you can. Be sure to stay hydrated and to be aware of the impact of heat, and for some of us, humidity. If you're not used to the humidity, avoid drugs or other substances. And again, to get adequate sleep and rest. And to do that, one way to do this is to try to maintain a regular sleep schedule. Again, with exercise, to maintain contact with your family and friends. And this came up a number of times, but this notion of practicing gratitude, that this is something that you can practice in your daily life, to thank those who help you, to acknowledge the contributions of your coworkers, acknowledge your own contributions, and be willing to actively hear gratitude from others about the work that you're doing. All of those things can contribute to your mental health. So from the perspective of the organization, it's helpful to have clear lines of communication established and clear means of communication established. Assess, you can't always assume, especially going into areas where there have been tornadoes or there have been hurricanes, that cell towers will be up, for instance. So be prepared to have alternative means of communication when that happens. Be sure to assess the welfare of your team and to be aware of and to help resolve any conflicts there might be between team members, and rotate assignments. We all know that when people are under stress, it can impede their ability to communicate clearly. So it's important that the organization help facilitate that. And I think that leadership is just crucial in maintaining the mental health of their team. So one way of doing that is to encourage workers to pair up in a buddy system to support each other and to help monitor each other's stress reactions and to provide support to them if needed in doing so. One suggestion was to pair more experienced responders with less experienced to help balance out, some of that inexperienced and the negative effects that might come along with that. It's also important to remember, that after the crisis, you can't necessarily just shut things down. You might have some ambivalence about giving up the disaster role, and or difficulty in doing that. It's hard to stop operating in an emergency mode. So things that you can do to help with that, either from an individual level or from an organization level, is debriefing, talking about your experiences with others who have been through the same things or similar things, and to figure out, it's kind of like a hot wash. What did you go through? What do you feel like went well? What did you feel could be improved? What do you need to be more prepared for the next time you enter the field in similar circumstances? Reconnect with your family, get a physical checkup, make sure that you're doing okay, to continue with normal leisure activities. And sometimes having hobbies can be very helpful to help you get back into the groove of normal everyday life. To continue to practice stress management, and if it helps you to seek and maintain spirituality, whatever that might look like to you, it might even just be allowing time for quiet time or meditation. Again, avoiding drugs and alcohol if you're experiencing negative after effects of being involved in the response, and if needed, to seek professional substance abuse treatment, or if it's mental health, see a therapist. Organizations can certainly help in the aftermath by providing mental health and resilience assistance or training, and to promote, counseling and debriefing. They can provide team group sessions and to provide staff support services. And really, I think it's important, and that's difficult to do because particularly in the storm seasons we've had lately, when they're coming one after another, and in some cases affecting the same areas. We all know Lake Charles went through such a horrible time this past, couple of years, that it's important not to overload employees and to give them time to recover between events and to ease back into their lives before they, so that they can be at their best. That's what I had to talk about today. What I really wanted to emphasize is that a lot of this comes from professional quality of life elements theory and measurement. And then I have some references here where you can either seek additional help or things that I drew from for this talk today. And that's it. Any questions?
Thank you, Dr. Sharon. I don't see any questions in the box. If anybody has any questions, please feel free to put them in. But I would just like to say that the information you've given is very, very important. And it is true. In the field, in the office, people get burnt out, and it's a lot to take in, and it's a lot to deal with. It's extremely stressful when you're seeing devastation day in, day out, and then you also have the stress of making timelines. So I totally agree with the fact that you should reach out and you should ask for help.
And I just want to say a really big thank you to all of you, because a lot of us have been on the side of the table and have really benefited from the services that you've provided. And I want you to practice gratitude and understand how grateful we are for what you do.
Yes, that is huge, because there's so much to be thankful for, and it really does mentally take you from a negative viewpoint to a positive one, which helps in any situation. So if you guys have any questions about this afterwards, you can feel free to email me or reach out to Dr. Sharon, or I can forward any emails to her. But Sharon, I appreciate you so much for coming out and talking with us today. Do you have any last comments? I think I lost her. All right, guys. Well, we will see you next time on Claims Corner, and you all have a wonderful and safe Memorial Day weekend.